Hello everyone. So I'm here to present my second article under Module 8, Economic and Related Issues. So the title of the article is COVID-19 Pandemic and Challenges for Socio-Economic Issues, Healthcare and National Health Programs in India. So this article was written by Hema Is Gopalan and Anup Misra. So the abstract of this article, as you can see, coronavirus diseases is the prime actor of this article research. So the national lockdown was imposed in India following the novel coronavirus pandemic. So in this paper, we will discuss the health and national healthcare challenges, the socio-economic impact following the lockdown with focus on population belonging to low socio-economic stratum, or they called ECS, or those people who are living in poverty line. So they have already indicated the result of their article, which is while the nationwide lockdown has resulted in financial losses and has affected all segments of society, the domino effect on healthcare and nutrition could possibly pose major setbacks to previously gained success of national health programs. So we will one by one discuss these impacts of lockdown followed by the uh, pandemic. So for the introduction of this article, coronavirus disease pandemic as caused by SARS-CoV is of unprecedented global public health concern. To combat this disease, the government of India imposed a lockdown in most districts of the 22 states and union territories, where confirmed cases were reported from March 24, 2020 onwards. Currently, the lockdown has been extended till May 31, 2020. So this article was written a year ago. The government of India, they said, has claimed success in the fight against the coronavirus pandemic, stating that the number of cases would have been more if the nationwide lockdown had not been imposed. However, this view is now being contested as currently numbers of COVID-19 cases have surged. So they do not believe that, as claimed by the government of India, that if not because of lockdown, there might be more cases of COVID-19 patients. But many are also questioning those claims because just recently or during this conduct of this review, an increased number of COVID-19 patients has increased. So in this brief review, they aim to discuss the impact of the lockdown in response to the COVID-19 pandemic on social, economic, health, and national health programs in India. Now, for the methodology, a literature search was conducted using PubMed and Google Scholar. In addition, existing guidelines, including those by Ministry of Health and Family Welfare, Government of India, and articles from several non-academic sources, example news websites and other sources were also accessed. So basically, this article was a composition of other published articles and research to come up with this new article, which is basically a review article. Okay, now let's discuss the result of this article. First, we have the economic impact. So the real gross domestic product, or GDP growth, had been estimated by the Reserve Bank of India at 6.2% in 2019 to 2020. The International Monetary Fund, however, lowered India's growth forecast by 1.3 percent points to 4.8% for 2019 to 2020 and stated that India's growth had slowed sharply. So therefore, it is self-evident that an economy already affected by slow growth in the previous fiscal year would severely affected by the lockdown as a result of the pandemic. The Small and Medium Enterprises Market Ratings project that the nationwide lockdown is expected to incur losses over $4.5 billion every day during the lockdown. The healthcare sector, the fourth largest employer in the country, and specifically the private sector, which provides nearly 80% of outpatient care and about 60% of inpatient care, is currently facing 90% losses due to decrease in outpatient attendance, elective surgeries, and international patients. So during the current pandemic, the economic downturn has greatly affected the people from the lower socioeconomic stratum or SES as mentioned. The distressing media visuals of migrant laborers going to their native places from the cities on foot during the lockdown has been critically debated. Remittance of money to the home country, which many migrant Indian workers probably do, is another way of poverty reduction, economic development increase, and increase in GDP. Economic impact of this pandemic is likely to be more severe for India in the following manner. First is the increase in poverty, pushing more people below poverty line. So basically, during the lockdown, people or the citizens of India are not allowed to go outside to look for food or to work for something. So the increase in poverty is is expected to increase. Second is worsening of socio-economic inequalities. So those who are uh, doing well in their life or those who are in high economic status, they might be affected, but they might not be more affected compared to those people who are living in socio-economic stratum or those living below in poverty line. So thus affecting health and nutrition indices. So those poor probably develop more diseases compared to those who are in high economic status. And lastly, we have compromise in health-related precautions, use of masks, social distancing, seeking medical advice in case of cough and fever. Okay, those are the economic impact of lockdown in India. Now, second, let's move to the socio-cultural challenges or socio-cultural impact of the lockdown in India. So, the social fabric of India thrives of interdependence, both emotional and economic within families, relatives, and friends. Close physical interactions like living in crowded housing and other places, pushing, jostling, are very common. So basically, if you are in India and you are living in the socioeconomic status or below the poverty line, you are expected to live in this kind of situation, living together despite of the imposition of lockdown, like social distancing and other uh, health protocols. Now, as you can see in a picture, despite of the lockdown, crowding has been observed in religious places during travel or even while purchasing liquor at the shops. So despite of the lockdown, people in India are still doing some religious gatherings. So that's basically one of the reasons why there is an immense increase of COVID-19 cases in their country. And also the other factor affecting to the increase of COVID-19 cases is purchasing liquor, drinking, even in public places in India. But the more troubling aspect is the lack of proper provision of safety nets, especially safety nets for food. For those hit the hardest by lockdown, due to the enormous scale of the problem of the government schemes remain vastly inadequate. So as a result of the lockdown, there is increased possibility of malnutrition among the low socioeconomic stratum people. So as a response, the Food Corporation of India recently allotted 12.9 metric tons of food grains under the Pradhan Mantri Garib Kalyan Anna Yojana as an initiative of Government of India in its fight against COVID-19 pandemic. So the efficacy of this scheme and adequacy of food distribution remains to be seen. So there is already a problem of malnutrition in India, and when COVID-19 hits the country, the cases of malnutrition or the problem of malnutrition in India immensely increased. So as a response, the government of India allotted metric tons of food grains to be distributed, especially those people who are living in socio-economic stratum. Now let's proceed to the impact of the lockdown in India on health prevalent diseases and national programs. So morbidity and mortality due to COVID-19 in India are largely attributable to comorbid conditions. Is illustrative example, non-communicable diseases like diabetes, hypertension, or cardiovascular diseases. So this study has been confirmed that those died in COVID-19 cases are also attributed to having some comorbid conditions. So they're also experiencing other diseases apart from having COVID-19 uh, virus. But there also might be suffering from diabetes, hypertension, or other cardiovascular diseases. As a result, COVID-19 has the potential to cause disruptions to health and health services in India in different ways. So let's take, for example, according to Gushal and his associates, they used predictive models and projected that the duration of lockdown is directly proportional to the worsening of glycemic control in patients with diabetes, as well as would increase diabetes related complications. So such an increased load of diabetes related complications will put additional load on an already overburdened public healthcare system. So further, such uncontrolled glycemia and increased cardiovascular complications have the potential to increase the severity of COVID-19 in patients. So basically, the country is not just facing the current COVID-19 disease, but also they're also struggling of handling non-communicable disease or comorbid conditions like diabetes. So during the lockdown, there's this article has found out that those having diabetes as eventually having complications which resulted to given additional load to the overburdened public healthcare system in India. So they are not just facing COVID-19 but also they are also handling or struggling from those patients or people having other comorbid conditions. Then the lockdown could also be a cause of weight gain during the COVID-19 pandemic because of poor physical activity, increased snacking, and consumption of calorie-dense foods. In an observational study conducted by the research, in this research, carbohydrate consumption and frequency of snacking increased by 21% and 23% respectively. Exercise duration was reduced in 42% patients and weight gain occurred in 19% of patients with type 2 diabetes. So weight gain and obesity could increase the severity of COVID-19 and may increase the risk of development of diabetes and other cardiovascular disease in the future. So those people who are under the lockdown, they eventually gained weight because of poor exercise and great consumption of calorie dense food. So high consumption of calorie dense food, and then they're just doing poor exercises. So the result was weight gain, and weight gain, according to this article, has something to do with the development of diabetes and other cardiovascular diseases in the future. So another impact also is that other diseases, the control of some of which had shown an encouraging trend until now, could also surge. For example, human immunodeficiency virus, TB, and or tuberculosis and malaria-related deaths over 5 years may increase by up to 10%, 20%, and 30% respectively, compared to a scenario without COVID-19 pandemic. So this article found out that not just COVID-19 cases increase in India, but also cases of HIV, tuberculosis, and malaria-related deaths might increase respectively due to this COVID-19 pandemic following its imposition of lockdown. So the reasons are many. So others like interruption of antiretroviral therapy, reductions in timely diagnosis and treatment of TB, and reduced prevention activities including interruption of planned net campaigns for malaria. So in conclusion of this article, the COVID-19 pandemic has necessitated the need for attention to the underserved and marginalized populations holistically. To prevent long-lasting adverse health outcomes, economic stressors on the whole population will need mitigation, and quick changes in policy would help. Finally, the national health programs for communicable and non-communicable diseases must be revitalized and strengthened. So that's all for this article. So thank you for listening. So I'm Ricky C. Arot, a MAID student in a Master of Arts Education major in Social Science. Thank you. Manama.